Good evening. My name is Karen, and I'm a Community Education Coordinator for Boulder Community Health. I'd like to welcome you to tonight's lecture on preventing falls and keeping your independence. I'd like to go over the format for the lecture. The lecture portion will last about 45 minutes. Afterwards, we'll use the remaining time for questions. Please type your short general question in the chat box below the video on your screen. We'll take as many as we can. On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Dr. Koby Caplan. Board certified in both geriatric and family medicine, Dr. Koby Caplan joined Boulder Community Health in September 2024. His interests include preventative care, humanistic and narrative medicine, falls, patient-centered care, optimizing bowel movements, and mental health. Dr. Caplan sees patients at Geriatric Medicine of BCH in Boulder. Welcome, Dr. Caplan.
Good evening. I'm absolutely thrilled to be here virtually today with all of you guys. It's a Wednesday night, 920 plus people registered to hear about falls, so it's something I'm very passionate about, and I hope that it's a good learning experience, and I try and make it fairly entertaining for all as well. Huge shout out to Karen, to Amy, and to Sam for helping me to put on this lecture. Without further ado, let's get going. Just a little bit about myself. Thank you so much for the kind introduction. I really like my life. I was born and raised in Houston, Texas. I had a very medical family growing up. My grandfather was a pediatrician, other grandfather an ophthalmologist. My parents are a gynecologist and a surgeon. My sister is a reproductive psychiatrist. I had plenty of choice what I wanted to do with my life. And I decided to sort of follow the family business of medicine, mostly because I knew I wouldn't make it as a baseball player. I did stay in Texas for undergrad at UT Austin and went to med school down in Houston at Baylor College of Medicine. After in-state tuition stopped being a thing, I decided to take my talents to Charleston, South Carolina, completed a residency there during the pandemic. And after being a little bit tired of the South, I decided to go to Mount Sinai, which is actually a mecca of geriatrics. And I got to work with legends in the field. I learned so much from them, and I feel like I have a very good pedigree and got good training to help you guys. I did start working at BCH almost a year ago, September 17th, 2024. Here is myself and my puppy Miralax. We go on a lot of hikes, I play music, and I love geriatrics. Why geriatrics? You know, there are so many fields out there. There are more prestigious fields. There are higher paying fields. My grandfather at his 90th birthday said, "Be happy as you are going to work, as you are going on vacation." And so I was in medical school at the time, and I decided to go into the field that made me happiest. I was interested in the field ever since high school when I saw a lecture on the aging of the baby boomers. And I calculated that when I was 30-ish and a real doctor, baby boomers would be geriatric. It would be unprecedented change in demographics, and that would invite its own set of challenges. It also is statistically the happiest profession, and I get a lot of pleasure out of doing what I do. I also love primary care. I like having to deal with all the organs. I view the human body as an awkward high school dance, which I only survived by dancing with everybody a little bit. And so I really love being a generalist and being able to keep up with all the developing technologies to the best of my degree. Also, in a great system like BCH, I can always ask for help. Let's talk about falls. Fall should be a season, not an action. I tell this to all my patients. Fall, you get cooler weather, football, carotenoids. Falls can take everything away from a person that has put their whole life into trying to build something for themselves and for their loved ones. Let's talk about some numbers. Falls are extraordinarily common. A quarter of all older adults fall yearly, and a new study that came out said only about half of them tell their doctor concerned about losing their independence. They're an extraordinarily common cause of hip fractures, and other such fractures that can really get in the way of you living your best life. They're also a significant cause of traumatic brain injuries, which go often underdiagnosed. These can mimic dementia and take away one's independence not only due to physical function, but due to mental function as well. The cost of non-fatal falls was about $80 billion in 2020, and it's projected to increase in 2030 to over $101 billion. This is just a fraction of why we want to prevent falls. Preventing falls is everyone's responsibility. In addition to saving money, Medicare and Medicaid, they are spending lots, and its future is uncertain. Patients want to stay independent. People don't like being told that they have to sacrifice their freedom for safety. And also, it's important for the family dynamic for parents to stay as independent as possible for as long as possible. How do we stay upright? I often like to imagine, what does it involve to step up onto a curb? It takes thousands and thousands of micro calculations in the brain, coordinating between vision, mind, body, and sense. You have to see a curb that you stand up on. Your brain has to process where it is, relying on the signal from your eyes. You have a whole internal gyroscope, a system of balance that determines where you are in space, and frequently this system can have problems. Blood pressure. We always want to control our blood pressure. Sometimes if the blood pressure is off, either because it's too high or too low, that can impair our coordination and increase the risk of falls. As you get older, you frequently can lose some of your musculature, and that weakens your stability as well. There's a concept called proprioception, knowing where you are in space, and sometimes certain conditions, certain medications can limit this. It's very important. Sensitivity to your skin and your environment as well, which is tough to change. For the more visual learners out there, here is a map of all these things. You have to have good spatial foundation, you have to have good eyes, you have to have a brain that's able to perceive the messages and to act on them. You require balance to make those micro adjustments if you do feel unsteady, and the strength to step onto the curb and off. Proprioception, knowing where you are in space, that involves your muscles, joints, and skins, and your sense of body in space. And also your vestibular system, which if you want to learn something cool about the human body, look up the vestibular system. It's as sci-fi as the body gets. This is where I feel that it's our job as providers to help reduce your risk of falls. You want to look for weak spots in your system. The brain is important for fall prevention, and to optimize it requires A, doing some work, and B, preventing harm. Startlingly high numbers of older adults drink alcohol, and particularly in Colorado, use THC. There's nothing necessarily wrong with that. My 96-year-old grandfather loved the euphoric effects of gummies. They helped his appetite, and they helped him sleep. That being said, it can also impair balance if the dose is too high, if it's interacting with other medicines or substances, and if it's not done carefully. Certain neurologic conditions, such as dementia and Parkinson's disease and various neurologic disorders, can increase the risk of falls. These are extraordinarily common in our population, and they're tough to modify. Certain medications, can increase the risk of falls, and particularly because as you get older, you get more and more medicines for more and more problems. And a lot of times in a 20-minute quick primary care visit, we don't have enough time to go through what are you actually taking, why are you taking it, and is this necessary? Is this doing more harm than good? Certain things like brain fog can also contribute it. Inadequate sleep, a recent infection such as COVID is notorious for this. Blood pressure, as I mentioned above. Certain medicines can impact balance, and even something as simple as Tylenol PM, which you take just to get to sleep, can drastically increase your risk of falls. It's important to look at the medicine side effects and talk about over-the-counter supplements and over-the-counter medicines with your physician. Particularly meds for anxiety, such as benzodiazepines, are notorious for making you fall. The first thing that you learn in geriatric school is get rid of the benzos if you can. This is an example of someone a little bit at risk for balance, an inflatable arm tube waving man that is used to advertise our favorite products. Vision is crucial for falls. To see the curb, to avoid the curb, to anticipate the curb, you have to see the curb. As you get older, there are a number of conditions which can affect your vision. Colorado is a very dry climate, and several patients complain of blurry vision due to dryness. Glaucoma is a silent killer. Glaucoma is the buildup of pressure in your eye and ultimately can damage your nerves and arteries in your eye. Cataracts are extraordinarily common. I call it arthritis of the eyes. A lot of people get it, and it's a fairly straightforward procedure to have it interchanged. There's a very rare but devastating condition called temporal arteritis, which is an inflammation of this artery right here called the giant cell artery. And if it goes underdiagnosed, it can cause permanent vision loss. Also, many patients suffer from light sensitivity and impairment due to a variety of conditions, such as ocular migraines. Your brain has an internal balance center. As I mentioned, a gyroscope, one of those fancy devices you see on boats that tell you, are you level? Or if you're more into construction, a level in the brain. And these can frequently go haywire. Conditions such as BPPV, or benign paroxysmal positional vertigo, and many medications are known to affect the vestibular system. Again, cannot emphasize the importance of blood pressure. If your blood pressure is too low, this can affect blood from getting to your brain, and you can feel lightheaded and dizzy, which can increase your risk of falls. Dehydration is also notorious for causing falls. If you get older, your thirst reflex gets weaker. Your body isn't telling you that you need to drink as much, but you need fluids just as much, if not more, than when you were young. Also, certain conditions like leg swelling, the fluid is not in the arteries where it belongs, but it leaks out into your legs, like if you have edema. These are all things that can get in the way of your body's natural balance and vestibular system. Also, if your blood pressure is too high, sometimes you're at risk for what's called orthostatic hypotension, meaning that you change positions too quickly, and for a few seconds, your blood pressure drops, and your body is not able to pump sufficient blood to your brain. Essentially, you stand up too quickly, commonly at night, and you feel intoxicated for several seconds. It's very important to do movements slowly, particularly if you're susceptible to orthostatic hypotension. Polypharmacy. Almost all my patients are taking more than 4 prescribed medicines due to a variety of ailments, but this is associated with an increased risk of falls. As you get older, your liver and kidneys, which are mainly responsible for clearing toxins and medicines from your blood, they become less effective. So sometimes you need a lower dose of medicines, such as gabapentin, to get the same effect because it stays in your system for longer. These are tough to anticipate, and it's important to discuss these risks with your provider. It is also important to go through your medicines and ask, is this necessary? Frequently, with a new admission, with seeing a new specialist, we take a problem that is temporary and keep you on a medicine for life without really asking, is this doing more harm than good? Neuropathy is extraordinarily common as you get older. This is where there's some impairment of the nerve, be it from long-standing diabetes, from lower back problems such as a slipped disc or spinal stenosis that compresses your nerve. I often like to think of it as the I-70 tunnel going west towards Silverthorne. There's no traffic when there's 4 lanes, but suddenly when it's reduced to 2 lanes, you get a backup of cars. This is a similar feeling that your nerves can experience if you have spinal stenosis. Another very common problem that I see in a lot of my patients is arthritis. If it pains you to step a certain way, you may have to make sudden movements to stop having that pain. I always recommend staying ahead of arthritis if able. It's also very important because sometimes if we need strong pain medicines to control the arthritis, to control the falls, the strong pain medicines have the side effect of falling. It's notoriously difficult to help find the right balance, like this poor lady walking the tightrope. I personally recommend a lot of my patients to take a max dose of Tylenol, 1,000 milligrams 3 times a day. I personally like to combine that with the topical Voltaren gel, which is like ibuprofen in a gel form. I also think that topical medicines such as lidocaine and CBD are underutilized. As a side note, because I talk about this a lot, I really recommend being cautious with medicines such as ibuprofen or Motrin. These, as you get older, can wear away the lining of your stomach. can cause blood pressure changes, can lower your salt levels, and can increase your risk of bleeding. So it's important to have these conversations with your doctor and to help navigate the balance between medicines that control the symptom and avoiding side effects of the aforementioned medicines. Urinary symptoms. A lot of my patients have to get up at night and go to the restroom. This is unfortunately a common thing. It's hard to prevent, and it increases the risk of falls as you're not necessarily oriented, you can't necessarily see as well, and you may be dehydrated from a night of sleep. Many patients have urinary urgency. Males, because of prostate issues, if you are unable to fully empty your bladder due to an enlarged prostate, you may have more urinary frequency, especially at night. If you're a female, you're more predisposed to incontinence given pelvic floor laxity that can occur with time, and especially if you've had multiple children. I didn't write this down, but sleep apnea is also a notorious cause of having to urinate frequently at night. So sometimes, even if your prostate is fine, even if you don't have any urgency during the day, there's no structural issues, sleep apnea can frequently present with having to go to the bathroom too frequently at night. Also, urinary tract infections are very common in older adults, particularly older women, and so symptoms should be anticipated and treated. I also always recommend changing behavior before introducing more medicines that can cause more side effects. It's always helpful to empty the tank before retiring at night, and it's always helpful to treat constipation. I'm also very passionate about constipation, as you heard from my biography, and as you may have inferred from my naming a puppy Miralax. If your bowels are full, this limits how much your bladder can expand, and that can cause urinary frequency. Frequently, if you address the constipation, the urinary issues can soon follow. You may be looking at the slide and saying, what is Sanctura? It is one of my new favorite medicines. A lot of medicines that can calm your bladder down at night that are used for urinary urgency, such as oxybutynin, have tremendous amount of side effects. I've personally found anecdotally, and speaking with other geriatric and urologist colleagues, that this medicine really doesn't have the same side effects as many of the medicines, and many of my patients report improvement in their nighttime urination once we've ruled out other causes, and it doesn't seem to cause the grogginess and increased fall risk than most. It's maybe if I have another kitten or a puppy, I can name it Sanctura. It is important to design nights with safety in mind. Again, I prefer behavioral changes and devices over risk and medications and their side effects. There is no shame in getting a bedside commode, which can drastically reduce the risk of falls by reducing your blind journey to the toilet overnight. And even urinary pads or Depends are perfectly safe alternatives if you do feel unsteady on your feet. I like to prevent falls at all costs. Environmental controls are tough. Particularly as I was born and raised in Texas, I didn't have a ton of idea as how to counsel people how to walk on snow. Typically, we want to avoid unstable ground, such as uneven sidewalks or trees with lots of roots. It's very important to wear good footwear with grips. We don't want you going and get the paper in your slippers. It's important to wear shoes with good grip, particularly in icy conditions. You want to avoid small rugs. They are trip hazards. They can slip out from under you. And even though it may tie the room together, as they say in The Big Lebowski, it's a risk factor. You want to avoid low tables, particularly ones that you could pass at night, as these can cause injuries and falls. Uncontrolled pets. I believe this is my mentor, Dr. Lysette's dog here, and you wouldn't believe the amount of patients that I've had trip over their pets, their friends' pets, or their friends. Roller chairs can be unstable if you get up too quickly. Ice and snow, as I mentioned earlier. A lot of times, we can modify some of these risk factors and keep you independent in your home by implementing handrails, particularly in the bathroom, on the walls of the home, or by the toilet. This can help you, A, get up if you fall, B, prevent falls as it has something to hold on to. A lot of my patients are also resistant to utilize assist devices, such as canes or walkers or rollators, but there are so many falls that we could prevent if people swallowed their pride just a little bit and were able to carry a device around or use it on long walks, that they could add an extra layer of support. Your hips will thank you. FDR said, the only thing that we have to fear of falls is fear itself. Fear of falls is actually correlated with an increased risk of falls. I believe this is multifactorial, but among other things, it keeps you isolated, it prevents you from being social, it prevents you from exercising, and it prevents you from even going to your doctor some of the times. It's very hard to find the balance. Fear is protective for the right things, but I try to push my patients, not physically, but motivate you to try and be as active as you can be, and rather than sit and cower of the fear of falls, meet them head on, reduce your risk factors, and take steps and precautions that I have already discussed to try and either remove a toxic medicine, utilize a bar or guardrail, and change habits to try and keep you healthy. A lot of older adults lose weight, and unfortunately this can happen quickly, and a lot of times when it does, it can come directly from your muscles, specifically your thighs, your calves, and your hamstrings, and muscles that are helpful for maintaining stability. This is a term sarcopenia, and it means the slow loss of muscle over time. Before I see all my patients, I check their previous weights, and I ask about weight loss. Are your clothes fitting differently? Is your appetite changed? A lot of times, losing weight can be an alarm symptom, and there are things that we can do about it. Sometimes, like thirst, as you get older, you just don't have the taste buds. Foods don't taste as good. Sometimes it's a side effect to medicines. Sometimes you just don't have the appetite, and a lot of the times it's constipation. So it's important to anticipate these things if you have unexpected weight loss. It can also be a sign of a serious illness, such as a cancer. There have been several studies documenting how vitamin D deficiency is related to falls. A lot of times, particularly in the winter, and especially if you don't go outside too much, you can be deficient in vitamin D. I have a little block in my note where I ask all my patients about their screening, and I like to check for vitamin D deficiency. It's very important for mental health, having enough vitamin D. It's important to prevent the risk of falls, and it's important for bone health and bone mineralization as well. And these are things that impact all of my patients. This woman looked so sad. I hope she would be a motivator to you to keep an eye on your weight and let your provider know if you're losing weight quickly. There are ways that you can meet the risk of falls and the loss of balance head on. Cardiovascular exercise and keeping in good shape is important, particularly if you're on longer walks. Stretching can prevent cramping of the muscles, which is a common cause of falls. It can also maximize your flexibility and mobility. Maintaining the strength of your quadriceps, your hamstrings, your calves. These are very important for anticipating and preventing falls, as a lot of people do lose strength in their 80s and 90s. Balance, obviously, is very important for keeping your falls. And there are several studies that say that Tai Chi is incredibly beneficial for reducing fall risk. There is a study out of Taiwan where they compared fall rates of older women there compared to older women here. If you go to Taiwan, you'll see many groups of people, specifically older adults and specifically older women, practicing Tai Chi in their local park. These are slow and deliberate movements, trying not to hit the mic, and they're very good for promoting balance, coordination, and training the micro muscles that help keep you upright. They can also be great opportunities for socialization, great opportunities to have bonding time with activities, to meet new people. As a side note, socialization is also something that can slip as you get older, and that's very important for preserving your cognitive and physical function. In summary, these are things as a provider that I like to do. As I mentioned, I like to maximize Tylenol before reaching for other meds, and I also like Voltaren gel and other topicals such as lidocaine or even topical CBD. I once had a patient that said he was able to get off oxycodone entirely because he bathed himself in liberal amounts of CBD. A lot of medicines, particularly ones that were first line on former guidelines, such as diuretics just for blood pressure. These are medicines that make you urinate more to keep fluid off. These things can cause electrolyte abnormalities and dehydrate you. As I mentioned, benzodiazepines, such as Ativan or Valium, are notorious for causing falls. Anticholinergic meds, that's medical jargon for medicines that either an antihistamine such as Benadryl or this bladder meds such as oxybutynin. These are medicines that slow your body's reflexes down, can also make you constipated. Gabapentin, many of my patients are on. People like it because it does a lot of stuff and it can help with sleep, but there are multiple studies coming out that note the harms of gabapentin. I also was trained by a physician in South Carolina who said the antidepressant Paxil or paroxetine, if you ever start a patient on that, I will hunt you down. And so I like to get rid of that medicine because I live in fear of being hunted down. It's important as providers to inquire about sleep aids and over-the-counter supplements, as these can A, interact with medicines, B, and have unwanted side effects. For providers, I frequently think that a lot of physicians overdose their thyroid medicine. Just as a side note, a lot of times we see the normal number, which in the lab values, we see 0.5 to about 4.5. And we like seeing those normal numbers, and especially with patients being able to see the results, they don't like the red button with the arrow too high or too low. That being said, the goal TSH, which is the thyroid hormone, and apologize if this is getting too academic, these can contribute to weight loss and also anxiety, and it's a reversible cause of sarcopenia or the loss of muscles. As a provider and as a family member concerned, I tend to push my patients and my loved ones, but not too hard. It's important to walk, but not run marathons. It's important to work out, but not to the point where you burst blood vessels. You have to meet your patients halfway, and that's the beauty of the art of medicine. As a provider, it's important to check your weights. I like to screen for vitamin D levels and check for orthostatic blood pressures in the clinic, meaning that we take your blood pressure sitting up and standing down, as this is a possibly preventable cause of falls. And as a side note, it's very important to screen for osteoporosis, particularly in your postmenopausal women, as a lot of times falls and fractures are preventable. There are a lot of cool toys out there. I'm actually working with administration and Dr. Lysette to try and improve our osteoporosis screening and treatment. This is the part where I shamelessly plug geriatrics. We are getting very busy, but we are still taking new patients. We tend to see older patients with multiple medical problems, with geriatric syndromes such as falls, cognitive impairment, at risk of placement issues. Going left to right, my nurse practitioner, Emily Martel-Rousseau, myself, my trailblazer and mentor and good friend, Dr. Elizabeth Lysette, Dr. John Addison, and nurse practitioner Julie Van Dyne / wound guru. We really like our team. Geriatrics is a special field. It's a special clinic. We're able to have 45-minute visits, even for follow-ups. And a lot of times, patients with multiple medical comorbidities, with frequent falls, with polypharmacy, without much support staff, it's very difficult for the regular primary care doctor to handle some of the geriatric patients that we see in our clinic. We are taking new ones, and we do anticipate some growth with the hiring of new providers. Please start being judicious about referrals and requesting us, as there are some patients that like me but don't need us. A lot of times, your primary care doc can handle you. But we really love our team, and we're really excited for our growth. Say what you will about AI, but I thought it was very amusing that I could ask the computer within 10 seconds to draw King Leonidas kicking a benzodiazepine down a big pit like in the movie 300. I thoroughly enjoyed giving this talk to you. It looks like I'm a little bit under time, but I anticipate a number of questions, and I eagerly look forward to answering them for you. That's me relaxed. Thank you so much for tuning in on a Wednesday night, and again, I'm so happy to be here. Thank you.
Thank you so much, Dr. Caplan. That was very informative and interesting and entertaining all at once. Thank you very much. We do want to remind our audience that now is the time for questions. So please put your short general question in the chat box below the video on your screen, and we'll get to as many as we can. In no particular order, we have received some questions.
Wonderful.
So I'll just start asking some of them. You mentioned proprioception. Can you describe that a little bit more, and how do you know if that's happening?
It's really tough. It's tough to proprioception. You nailed the pronunciation. That's very impressive. It took a lot of med school for me to get that right. Proprioception is knowing where your body is in space. Again, some people have neuropathy or certain neurological conditions that may inhibit where you are. And if you're on a road trip and you don't know where you are on the map, you don't know which way to turn. This is similar on a micro scale for falls. I'm not sure if that answered the question, but it's important, and sometimes it's preventable or treatable, knowing where you are in space.
All right. Get to another question here. Just 1 second.
Absolutely.
This person's dad is getting older. Can you give a bit of advice for children on how to introduce this subject to older parents?
It's really a tough thing to breach. How do you, in some ways, take on the role of a parent to someone that was your parent? I loved pediatrics, and partially I love geriatrics because there's a lot of overlap between pediatrics and geriatrics. It's communicating through a third party, and it's addressing, a team approach, and sometimes it takes a village. I think the best way is just to have a frank discussion. I think you come from a place of love and you say, I'm worried about you. I'm worried it's your cognition. I'm worried about your risk of falls because part of my love for you is I want to keep you safe and I want you to be happy and healthy. A lot of what I do is walking the tightrope between independence and freedom and safety. I and the children tend to prefer erring on the side of safety. Patients always want to maintain their freedom. I think it requires an individualized approach. I think it requires getting rid of things that are harmful and maximizing behaviors that are helpful. I think the more socialization you do, the more exercise you do, the better you can anticipate physical and mental problems and screen for them, the better you can handle stress. It's a notoriously difficult thing to do. I have a difficult job in a lot of ways. And it's something that I worry about and am grateful for the relative health of my patients and family.
Doctor, would you repeat the question that I asked you?
Oh, the question was, my parent is aging, and how do I broach this topic of discussion? Should I repeat all questions?
Yes.
Sure, great. I think there's a microphone issue. Yeah, it's tough. A lot of my friends, a lot of my colleagues are starting to deal with this, and I'm like, wait, I haven't even started raising kids yet. It's tough to be the middle generation, but I think that if you come at it with a place of love, and you say, we just want to help you maintain your life and to keep you enjoying golf, enjoying going to Broncos games, enjoying hiking the mountains, we just need to make sure we do it safely. A lot of times, certain things can be modified.
Will you please repeat the name of the medication you recommend for controlling urinary frequency and spell it?
I knew I was going to get this question. Again, I don't necessarily recommend everyone going on this medicine because, it calms down your bladder at night and it can have side effects. It's much more important to do the appropriate workup and to try and treat the underlying cause. That being said, if you've seen urology, if we know the prostate's not the problem, repeat. I'm sorry. What was the name of the medicine that I recommended that I said if I had another dog, I would name it? The medicine is called Sanctura, Sanctura. It also goes by the name Trospium, Trospium. It can be a little bit expensive, but there's a pretty reasonable coupon on the website goodrx.com. And I encourage you to run a lot of your medicines by that website as well, as it can result in some cost savings if Medicare or other insurance is not covering the cost. Again, I do have to emphasize, this is a conversation with your doctor. Please don't just start taking this medicine on a whim without a proper workup. I don't know you, I don't know your health.
Medicare covers geriatric doctors, but not geriatric care management. Can you please explain?
Absolutely. The question was, Medicare covers geriatric doctors, but not Medicare, they don't cover care management. We are fortunate to be grant funded, and we have a built-in clinical care coordinator named Lucinda, who is my right hand. A lot of the problems we see can't be fixed with pills. I think our clinic is a very good model, but a lot of times there's more of an emphasis on social determinants of health. I'm hoping that with continued funding in research and seeing how important it is, particularly as the baby boomers age, we'll realize that it is a team sport. You can't play quarterback without an offensive line.
Can you name a few common medications that impact balance?
I'd love to name medicines that impact balance. A lot of these are blood pressure medicines. Again, blood pressure that is too high or too low. These include diuretics like hydrochlorothiazide or Lasix, which a lot of times people need for heart failure. But sometimes if they're just used to manage blood pressure, there are safer alternatives for preventing falls. A lot of over-the-counter meds are notorious for causing these, such as anything with PM after it, like Tylenol or Advil PM. Certain antihistamines, specifically Benadryl or diphenhydramine. Certain antidepressants and anti-anxiety meds, such as Paxil or such as Ativan. Really, there's a whole list of medicine called the Beers criteria that really appealed to us young med students. But if you look at the Beers criteria online, you may see that, wow, I'm taking a lot of these medicines. Sometimes you need them. Sometimes there are safer alternatives.
Is it dangerous to take 1,200 mg of gabapentin daily?
You know, gabapentin, it is a medicine that helps with a lot of things. You'd have to talk about these risks with your doctor. The maximum dose of gabapentin, if I recall correctly, is 900 milligrams 3 times a day. And so you would be well within that dose. However, as you get older, your kidney clears gabapentin, and as you get older, you lose kidney cells, which can impact the rate of clearance. So if you talk with your doctor, there is a certain gabapentin adjustment based off your kidneys. I tend to prefer giving gabapentin only at night, as it can cause daytime sleepiness. But I'm going to plug another medicine. It's actually a supplement called alpha lipoic acid, ALAD, and I'll spell that, ALPHA LIPOIC acid, alpha lipoic acid. Again, this is pretty anecdotal. I haven't found a ton of science that proves it, but it tends to be a vitamin or a supplement that helps with nerve regeneration. And I've been able to help people reduce their dose of gabapentin and feel better by supplementing it with a less harmful medicine. Again, that's alpha lipoic acid. You can get it online or you can get it at your pharmacy. I also see topical CBD and THC creams, like marijuana creams, work pretty well for localized neuropathy. So I like to maximize topical medicines before reaching for all-out medicines like gabapentin, which may have more side effects, especially as you get older.
What is the process to come and see you?
I'm getting very busy. I think I'm booked out for a couple weeks now. Typically, you need a referral from your primary care provider or another provider. And we can do, a one-time assessment and recommend certain changes. But we are still taking new patients. So I would ask your primary care doctor, if you need an assessment, to place a referral to geriatrics. And please have them list just one problem. A lot of times they put several hundred check marks and I have to go through and uncheck them all. So we are getting busy, but geriatrics is a growing field. And I hope that we can have the manpower, especially in a desirable place to live such as Boulder, that can adequately care for its aging population. Oh, I'm sorry. What is the process to come see me? She has a sign that says repeat. Ask your primary care provider or a different provider for a referral, and it's done typically through the Epic system.
This person bones test strong, but they break their ribs. Do you know what might be wrong?
Rib fractures are actually very common in older adults, particularly if you fall forwards or fall into a blunt object such as a table. Ribs naturally thin as you get older, and it may not be even related to osteoporosis. As a side note, I recommend having intense goals of care discussions with your provider, as the process of CPR which we try and revive you after your heart stops beating, very commonly causes broken ribs in older adults and often more suffering than it's worth. It's not necessarily anything you did wrong, and it's an unfortunate problem because it hurts to breathe, it hurts to cough, and worst of all, it hurts to laugh. The pain does usually subside, but I tend to maximize high-dose Tylenol, as I mentioned earlier, 1,000 milligrams 3 times a day, and topical medicines such as lidocaine patches to really take the sting away. I feel your pain. It's no fun.
Do you recommend balance boards?
Balance boards. I would probably recommend a physical therapy evaluation before balance boards. It's sort of like, would I recommend going to the gym and bench pressing 200 pounds? Sure, but you probably have to work your way up to it. I'm not very well versed in balance boards, but I think that any technology used safely and used under the supervision of an expert, if it helps you stay balanced, it helps you stay balanced.
What do you think of Ambien?
Oh, Ambien is my least favorite medicine. Least favorite. My mother took Ambien for a long time, and I begged her every year for my birthday to get off Ambien. I should have included that in my slides, as that is one of my favorite medicines to try and discontinue. People love their Ambien because it fixes the problem. But I would ask you, would you put a Band-Aid over a boil or an abscess? No, it technically treats the problem and hides it from view. But the best way to get to sleep is to practice good sleep hygiene, meaning that you limit screen time, and take a safer medicine such as melatonin or even trazodone or mirtazapine that is not A, linked to falls as much, and B, linked to significant cognitive decline as much. I could have a whole lecture on why you shouldn't take Ambien and similar medicines that just knock you out.
Can you become dependent on Miralax?
I personally am, because I think she's wonderful. Miralax is not addictive. It works by sucking water into your colon, and it is dose dependent. You know, if you have to go for a colonoscopy, they sometimes say, hey, drink a whole jug of Miralax, and you will go. That being said, people do tend to feel, if they get used to it, they tend to be more constipated if they stop it. Certain bowel medicines, like senna-containing ones, should only be used for short bursts, as this can be physiologically addictive. And the question, if I didn't repeat it, was, can Miralax be addictive?
How does lowering your synthroid contribute to weight loss?
Great question. That was a little bit technical, and I did sort of mention that for the providers in the audience. So the thyroid is a very how does lowering synthroid contribute to weight loss? So a lot of times your organs change as you get older, and so do the normal lab values. The thyroid is very important. It helps with metabolism, it helps with cognition, and a lot of people have been taking the same dose of synthroid for decades. We check thyroid hormone fairly often, not to get too technical, but the TSH is the chemical that your brain sends to your thyroid that says, hey, we need more thyroid. The TSH, for the normal value for older adults, is not the same value for a healthy 30-year-old. And a lot of times, too much thyroid hormone that you take can cause weight loss. It increases your metabolism, and therefore it can cause muscle loss and therefore falls. So a lot of times, you know, people don't really like when I mess with their synthroid. Sometimes they gain weight. Sometimes, you know, it can impact energy levels. But the textbook says the goal TSH, thyroid stimulating hormone that your brain sends to your thyroid, the goal of that is not the goal for most people. It's actually raised, and so I think we overtreat with thyroid disease. I do a lot of lowering synthroid.
Can essential tremors affect balance?
Can essential tremors affect balance? Yes, any neurologic condition can affect balance. You know, tremors can cause the decrease in fine movements, and it's important to anticipate changes and to try and control the tremors either with medicines or with therapies or with behavioral changes. The problem is some of the medicines used to treat tremors, such as propranolol, can slow down your heart rate and possibly increase your risk of the orthostatics that we talked about, and also falls. It's important to keep an eye on your blood pressure and to, if needed, see physical therapy or someone that can help you with your balance and anticipate these things.
Can you recommend any resources for walking on ice?
Can I recommend any resources for walking on ice? I'm actually pretty underinformed with that. I actually will do my homework and try and get back to you. I once heard that you should walk like a penguin, meaning that, I'm not sure if I'm still in the camera, but essentially by semi-waddling, talk to your physical therapist about this. I do not take liability, but essentially by keeping your steps a little bit smaller, you prevent yourself from slipping if too sideways of force is applied. I do recommend having excellent footwear with good grip, like hiking shoes. But these days, I would probably just ask Dr. Google or AI. I think probably it's better to walk when it's warmer in the afternoon if you go on a daily walk. And, you know, try to avoid areas where the sidewalks and streets are not iced, or salted rather. That's a great question, and I actually should do more homework because I did have several patients fall and have fractures as a result of walking on ice.
Is there a barefoot type of shoe or that will help with balance?
Is there a barefoot type of shoe that will help with balance? I'm not exactly sure. I think typically shoes with good grip, slippers are notorious, flip-flops and sandals are notorious for contributing to falls. I don't know of a particularly good one. I tend to like Hoka's a lot, H-O-K-A. They have a little bit of an elevated heel, and that helps with a lot of arthritis symptoms. A lot of my orthopedics and podiatry colleagues recommend Hoka's to their patients, but with it being a little bit of a higher heel, I would definitely try it on at the store and see how do you do with a balance perspective. Again, they don't teach us these things in med school, but they're things that I should know and things that I should research so I can better help my patients and my community.
Could nerve impingement in the lower spine cause poor balance?
Could nerve impingement of the lower spine cause poor balance? Absolutely. Nerve pain and nerve impingement is incredibly common and incredibly difficult to treat. It's sort of like, as I mentioned during the presentation, it's the Silverthorne tunnel where the nerve is being compressed and it's not able to send the signal as fluidly or as well. This can both cause pain, which can increase the risk of falls, contribute to neuropathy, that pins and needles sensation, and possibly impact proprioception, knowing where you are in space. So it's tough to treat. There are certain exercises, I again like to stay ahead of the pain with medicines such as Tylenol. But sometimes, it would require an intervention, such as one you could get at Boulder Center for Orthopedics or Spine West. And I have seen patients respond very well. I don't particularly like back surgery, but it is an important thing to anticipate and to be aware of. Sometimes the alpha lipoic acid medicine can help treat the severe neuropathy, but I've only seen it work in probably slightly less than half of my patients. So it's, again, something you should talk with your doctor about.
Would doing yoga help with not falling?
Yoga is very, very good at helping with certain balance exercises. Again, I would go slowly with the practice. We don't want you doing tree poses and standing on one leg if you're not able to stand on two legs. But that being said, yoga is very good for maintaining flexibility, for building up core and leg strength, and for it improves quality of life. People like yoga and it makes them happy. So I do recommend a lot of yoga and a lot of Tai Chi to my patients because they kill a lot of birds with one stone. They're social, they get you moving, and they can help you build a community, and they can prevent falls.
All right. When you fall, you feel out of control. Is there a way to fall safely?
Is there a way to fall safely? Sometimes when you fall, you feel out of control. That's tough. I think that, technology is one of the things that can help us mend the barrier. If you say, hey Siri, I've fallen and I can't get up, call 911. If you have, a life alert bracelet, you can push the button. And so many people carry cell phones in their pockets. They have access to people that can help. Ultimately, I don't really know if there's a way to fall safely, as a lot of times it is beyond your control. I think if you can anticipate symptoms and lower yourself slowly to the ground, you fall less hard and you fall with reduced risk of fractures. Sort of like if you have to jump from a high place, they say roll and absorb the whole impact with your whole body. Again, these are really tough split-second decisions to make, and I'd have to think about that. I think it's all about anticipating risk and trying to reduce that and trying to do as much exercise as you feel safe doing to fall less often and therefore more safely.
Would a PT or someone else be able to help with falling safely?
Would a PT or someone else be able to help with falling safely? Absolutely. I send so many people to PT. I'm surprised more of them don't buy me flowers. Physical therapy, it's, they're personal trainers, they're fit, they're educated, they go to school for 3 years after college, and they a lot of times know way more than myself about the human body and the anatomy of falls. I think if you at all feel unsteady on your feet, if you at all have a significant musculoskeletal symptom, any orthopedist is going to want to see that you've done PT before doing any sort of intervention on you. So I really recommend talking to your doctor about this to get a referral. I really, really love my local physical therapists.
What is the impact of iron deficiency anemia?
What is the impact of iron deficiency anemia? So your body is dependent on blood to circulate to give oxygen to your tissues. Iron is the building blocks of blood, and you need blood to maintain your blood pressure, to get the signals to your brain, and it also is a very common size of fatigue, which can contribute to falls. There are a lot of causes of iron deficiency anemia. Sometimes it can be the source of a bleed, like a chronic gastritis, likely from taking too much ibuprofen. Sometimes it's a sign of something going on in the colon, God forbid, like a colon cancer. Sometimes it's from certain medicines that may impact absorption. Sometimes it's from inadequate intake. Sometimes if you look up iron-rich foods, such as red meat, black beans, kale, and total cereals, a lot of different things contain iron, and even cooking with a cast iron skillet, if you really don't like any of those foods, that can add some iron to it. As a side note, I really don't want you to take iron every day. Iron is best absorbed taken every other day with something acidic with vitamin C like orange juice, and too much iron can make you constipated. Sometimes if you can't tolerate oral iron, an iron infusion is a great way to rebuild your iron stores quickly. So it's one of the reversible causes of fatigue and therefore falls.
Tylenol treats pain and Advil treats inflammation, correct?
Tylenol treats pain and Advil treats inflammation, correct? Sort of, correct. Tylenol is not an anti-inflammatory. It's not going to reduce swelling, but it tapers down the signal from the pain to the brain. A lot of times people say, oh, I tried Tylenol and it doesn't work for me. Because it interacts with the signals, it's best if there's some in your system at all times. So my first line pain medicine is Tylenol 1,000 milligrams. If you have liver issues, talk to your doctor. And taking that 3 times a day can help you stay ahead of the pain. Sometimes, I do recommend a short course of NSAIDs like ibuprofen if the pain is severe, if there is a recent surgery and there's lots of inflammation, and they don't have any history of bleeding or kidney problems. It's a shared decision you should make with your healthcare provider, but I tend to want people on as little Advil as possible. Again, Voltaren gel, which is a cousin of Advil, also known as diclofenac, diclofenac, can help with a lot of the symptoms of inflammation, particularly if there's one joint or hand arthritis, and it doesn't seem to have nearly the amount of side effects. But again, everything with a grain of salt, and I would talk to your doctor about this.
Does Trilogy help with balance?
Does Trilogy help with balance? Trilogy is an inhaler, and it's used for COPD. I have to think exactly what is in Trilogy. It's 3 different ones. Sometimes certain inhalers contain, don't want to get too technical, but albuterol, which can speed up your heart, and sometimes that can make you feel a little bit lightheaded. So, we want you to breathe better. If you can get oxygen to your brain, that's a good thing. But I don't necessarily know if it's related to balance. That's a great question to ask your provider.
What would be considered an abnormal number of falls that then you need to go to the doctor?
I think it really depends. Did you trip and were you able to, I'm sorry, what is a normal number of falls before you have to go see your doctor? That's a really tough question. To an extent, any fall is abnormal. If you fall and you trip onto your bed and it's the first one that you've had, you probably don't need to come and see me. But I'd say if you're falling more frequently, or if you're at high risk of injury, or if you had a medication change or a new life event, such as a hospitalization or a new diagnosis, then it's probably worth talking to your doctor about. I honestly think, 1 is the number of falls that makes me uncomfortable, as sometimes it only takes 1 to go from a really good quality independent life to essentially you're completely dependent. So I don't think there's a magic number, but I think that if you're concerned, I don't think that your doctor would ever be bothered by, I'm falling. It can be a disaster, and we want to prevent bad things before they happen.
Can you repeat again what you do as a doctor?
Yeah. Can I repeat again what I do as a doctor? I am a geriatric primary care provider, and I also do consults for patients that, have a very good relationship with their doctor, and they just feel like an extra set of eyes can be appropriate. So my visits are 45 minutes. I tend to take a couple minutes and get to know my patients. I tend to review if they've had any updates in their symptoms. I review their med list. I review how is your mental health, how is your physical health, how are you sleeping, any falls, how is your blood work looking lately? And I also spend a lot of time trying to anticipate bad things before they happen. You never know what can happen in this administration, and I really want you to stay ahead of your health, such as vaccines, before they happen, so I do a lot of preventative care. Geriatrics is playing tennis against the wall. You're not going to win, but you can enjoy the game.
Do people need a recommendation to see you?
Do people need a recommendation to see me? Yes, you need a referral, at least. I'm pretty sure you need a referral from either your primary care doctor or a provider. I will say that we're filling up incredibly quickly, and I'm reaching capacity of my panel, but we are hoping to expand in the next several months.
Dr. Caplan, is there anything else you'd like to say before we close?
I'm just really grateful for the opportunity. I think that, as the population ages, education is one of the best tools that we have. So, there are a lot of things that you can do on a Wednesday night, and I'm just so humbled and honored that so many people were willing to spend it with me and ask questions and look at my puppy.
We've come to the end of our time. I'd like to remind our audience that